So bringing wellness in a medical facility also brings great amount of satisfactions and result and onus also. Who will need a medical tourism, Dr. Prem? And why patient will need a medical tourism? Who will need a medical wellness and who will need a what kind of patient, right? So one is that patient after hospitalization, they stay longer for the follow-up care. Mainly cases of rehabilitation, even cosmetic cases, because after you do liposuction and all, the patient needs to be there with the cosmetic surgeon for 7 to 10 days roughly, I guess. You have to come back after 7 days, 10 days, and you can't tell them to come back after 3 days. Sometimes you tell them come back after 2 weeks. So there are many procedures where, now imagine patient coming from Middle East and tell him that come back once again after 2 weeks, I just want to do follow-up for you. Difficult, right? For them to make a travel. But that person can stay 14 days in resort, can enjoy, relax. They have the budget from Middle East. There is no problem with the budget. Even people who have a lifestyle disorder, significant lifestyle disorders, they can also go for medical wellness. When you go with the medical facilities or medical services, you feel like you're instructed. You feel like my doctor is saying not to eat this, not to eat that, not to do this thing, not to this. And as a human being, we don't like instructions, no matter what it is. We just don't like instruction. No matter if you are child, young, adult, sickness, whatever it is, human being doesn't like the instruction, forceful instruction, definitely they don't like it. In wellness, you take the self-initiative. Once the wellness is introduced, once wellness is provided to you, idea of meditation, idea of yoga, idea of all those things are provided, then these ideas are not provided as an instruction. They are provided as general rule of your well-being. And then if you do it, it is better for you. Then you take onus, then you take initiative. So bringing wellness in a medical facility also brings great amount of satisfactions and result and onus also. Renewed benefit from the old traditional methods which have been used for years. On my Instagram, you will see all kind of wellness I have gone through, from leech therapy to cup therapy to Kalari massages to feet massages to mud volcano and all those things. I experienced wellness therapy more than any wellness consultant would have ever done it. And when I experienced this thing, I believe that in our tradition, in our root, there are solution of so many problems which modern medical does not offer. And it's incredible. It's incredible in general. You can also combine all these wellness activities with the vacations and packages and all. You tell them medical wellness holiday package, wherein I'm going to take care of your recovery also. It's a huge thing. Big amount of money which is pouring in medical wellness from all those things. Key strategies, if you want to do it, make sure you're doing very seamless integration between medical wellness and medical. All those things needs to be interwoven. As I mentioned to you, they need to be beautifully interwoven, and you need to offer them more personalized, customized services, more enhanced services, looking at the one individual and curate those services that you can offer for every individual. In medical, again, you need a knee replacement, you need a dental, you need any cancer treatment. You can't customize. The treatment that you need it. But when you add a wellness component, you do customization. You ask his preferences, that whether you want some therapies, you want yoga style therapy, because there are many therapies which can enhance the recovery, up to 40% faster recovery and 90% delightful experience. What is the difference between satisfaction and delightfulness? So satisfaction, someone comes to me with some expectation and I fulfill that expectation, then I'm satisfying that person. Believe it or not, in today's world where the satisfaction is mandatory, but it's not everything. Why? If you order pizza, let's say Tejas order pizza and she gets a pizza, Is she going to write a review about it? Not necessarily. Why? Because she paid for the pizza. She is expecting pizza to come within 30 minutes. She is expecting it to be fresh, nice ingredient, quality ingredient. But don't expect that the pages is going to go and write the review for that pizza. Why? Because she's just satisfied. So with the modern world, satisfaction is not good enough. It's a mandatory thing. If her pizza was not fresh, was not delivered on the time, the first thing she will do, she will write a negative review. How many positive reviews do you need to recover one negative review? Any idea? The marketing system says you need 40 positive reviews. 40 positive reviews to recover from one negative review. And one negative review require just one single misshape. But to get 40 positive review, even though if you're delivering pizza on the time, even if you're delivering fresh pizza, still you don't get the positive review. You get positive review when you surpass the expectation. You do something beyond the expectation. So probably offering a goodie, offering something extra, offering something as a delightful factor. We go to a restaurant for the lunch and we went for the lunch, but they gave us a free starter or they gave us a small dessert at the end or some sweet or something at the end, and you feel, हाँ यार इसके लिए तो मैंने pay ही नहीं किया था. When you go to a hotel, you get a very nice clean bed and very clean bathroom and all those things. Still you are not going to write a review for that. But if they put a note there, we will be very happy to take care of those things. Here is a basket of fruit for you. That is delightful because you are not expecting, right? Similarly, talk about medical condition. Medical conditions are just doing the satisfaction, medical doctors and hospital and all. Because when a patient comes to your facility and you are providing that treatment, you are satisfying the patient. But if you add the component of wellness, you are delighting patient. You are telling patient that I am offering something extra. If you need a positive reviews now, you need to do the delightfulness practices also.